think it's very important that we, as wives, as women, advocate for our husbands because, like I said in one of the previous voice recordings, is that, you know, all these women are saying things like, oh, I'm the table and different things like that. But, like, what do you do? What do you do, again, if your husband loses his ability to speak? Will you speak for that man? If he loses his ability to walk, will you carry him? Now, for some, that's figuratively because, some of our husbands are bigger than us, but some of it is literally. There are times that I had to literally pick my husband up while he was in the middle of having a seizure. And these seizures that he was having, I truly believe that it was from the medication that he was taking. The doctors had him on different medications, and when he stopped taking the medications, that's when those seizures had stopped. So I thank God for wisdom and provision and just the ability and the know-how to do things that I didn't think I was capable of doing. But I had to advocate for my husband. There was particular medication called amitriptyline, gabapentin, what's the other medication? Baclofen. Like, when he stopped taking all three of those medications, the seizures went away. So just really be mindful of what we're putting into our bodies. The other thing is, when I'm talking about advocating for your husband, I'm talking about just being there for him, because when my husband had his neck surgery, July of 23, and basically what he had to have a halo placed on his head. The halo consisted of 4 screws, so he had to have 4 screws into his skull, and they had to do something, I forget the actual term they use, but they had to go into his neck the first day, re-break his neck to straighten it out, and then while they were waiting for things to kind of stretch out, they had to put something inside, like a spacer or something like that, to hold his neck open, and also attach a 15-pound weight to the halo to keep everything how it needs to be, right? So when I walked into the ICU room that he was in, I was nervous as heck. Like, my hands were shaking and everything. Like, I was so scared because I didn't know what to expect, but I knew that I needed to go see my husband, right? And I asked the nurse, I was like, how does he look? She's like, oh, he looks good. Everything's fine. So I went into his room, and when I seen those screws in his head and the halo, and I knew that the back of his neck was open. However, they did have something covering that. But immediately when I walked up to my husband to greet him, I could see the pain across his face. I remember him mouthing the words pain, and the tears coming from his eyes. And I talked to the nurses. I said, well, what pain medication do you have him on? Because I needed to know that. And I advocated for him to get a stronger pain medication. And the nurse said, like, you know what? Oh, that sounds like a good idea. I said, yeah, it does. Like, how would you feel if your neck is open? You just came out of surgery. My husband was in surgery for almost 9 hours. Almost 9 hours. So they were doing some extensive work, cutting open his neck and getting into those bones, breaking his bones to re-straighten his bones, right? And then having the screws. He had 4 large screws in his skull. I said, yeah, can you imagine? He is in pain. So again, that advocacy role. And the other issue is because of the health disparities amongst race, like with the racial health disparities, right? And sometimes you don't like pulling a black card or anything like that, but our black and brown people, especially our men, are overlooked. I did see things about like Alaskans and not Alaska, I'm sorry. Well, I think that's the right word. But also I seen, issues with, those who are Korean, Asian, and different things as such. But especially our black men. And I was there. And I'm like, give him stronger pain medication. Even when it came down to like, because the procedure was only supposed to last, he was only supposed to be in the hospital for a week, but he ended up being there for a little bit over 3 weeks, almost a month. And I did not leave that city until my husband was able to reuse his hands again, because he had lost his motor skills. He had he had begun to lose his motor skills. They call it a neurologic decline. I feel like he was hemorrhaging, but it's like it's not clear as to exactly what was going on. I think what they said with his spinal cord began to go back into the kyphosis that it was in. So, but yeah, I'll share more information about that. But yes, ladies, we need to advocate for our husbands.